Today, I am Arlina Salvador, third year student nurse from Nueva Ecija University of Science and Technology. And today, I will demonstrate a procedure on administering oxygen by nasal cannula. The goal of this procedure is the patient exhibits oxygen saturation level within acceptable parameters. For the equipment, check for oxygen delivery devices as ordered by healthcare provider. Oxygen tubing, considered extension tubing, humidifier if indicated, sterile water for humidifier, oxygen source, oxygen flow meter, and appropriate room signs. Bring the necessary equipment to the bedside stand or overbed table. Next is perform hand hygiene. Prevent the risk of microorganisms. Next, put PPE if indicated. Next is identify the patient. Good morning, ma'am. I am Arlina Salvador and I am a student nurse. May I know your name?
Yes, I am Leia Ignacio.
Okay. You can also identify your patient using door tag names, wrist tags, and bedside name tags. Next, close the curtains around the bed and close the door to the room if possible. If there is no curtains around the bed, you can use your body to cover the patient to provide privacy. And you can close the door if it is client's will, but do not lock it. Next, explain to the client what you are going to do and the reason why you are going to do it. Ma'am, today I will going to perform a procedure on administering oxygen by nasal cannula. This procedure is not invasive procedure, so it doesn't hurt you. Therefore, this procedure helps you to increase the amount of oxygen to your lungs received and delivered to your blood. Next, review safety precautions necessary when oxygen is in use. And place no smoking signs in appropriate areas, such as doors. Next, connect the nasal cannula to the oxygen setup with humidification, if one is used. And adjust the flow rate as ordered. And check the oxygen is flowing out of prongs. Next, place the prongs to the patient's nostril. And place tubing over and behind each ear with adjust comfortably under chin. Alternately, the tubing may be placed around the patient's head, with the adjuster at the back or base of the head. Place gauge pads at ear beneath the tubing as necessary. Next, adjust the fit of the cannula as necessary. Tubing should be snug but not tight against the skin. Next, encourage the patient to breathe through the nose with the mouth closed. Ma'am, pag hihinga po kayo, ilong lang po yung gagamitin nyo tapos nakasarado po yung bibig. Next, reassess the patient's respiratory status, including respiratory rate, effort, and lung sounds. And note any signs of respiratory distress, such as tachypnea, nasal flarings, use of accessory muscles, and dyspnea. Next, remove personal protective equipment if used, and perform hand hygiene. And document the procedure. Next is put on clean gloves. Next, remove and clean the cannula. And assess the nearest at least every 8 hours, according to the agency recommendations. And check for nearest for evidence of irritation or bleeding.